Hi, my name is Hira Siddiqui, and I'm the co-founder and chief operating officer for Science and Humans. Today on our podcast, The Science Behind the Humans, we have our chief health span officer, Dr. Fady-Shmouni. I'll have him introduce himself. Hi, Fady.
Hi, I'm Fady Hannah-Shmouni. I'm an endocrinologist and geneticist at the University of British Columbia and Science and Humans chief health span officer. My specialty is on adrenal disorders, including hypertension, PCOS, and cortisol-related conditions such as Cushing's syndrome.
Fady, let's start our conversation with understanding how the whole system of hormones work in our body. How do they work interconnectedly with different organs, and what does the impact look like when there is a underlying hormonal dysregulation?
Absolutely. So as an endocrinologist, I specialize in hormone care. Hormone stems from the word hormeo from Greece, and it stands for to stimulate. So the purpose of hormones as signaling messengers in the body is to stimulate different processes, including very important physiological processes pertaining to metabolism, immunity, inflammation, repair, and other important mechanisms. We have many hormones in our body, including steroids such as testosterone, gut hormones such as the GLP-1 receptor agonist that are readily available in the market today for weight loss. Inflammatory-related hormones like prostaglandins, and so many other examples. Just to give you context, the body produces over 300,000 peptides, which is a subcategory of hormones, and over important larger hormones to regulate various processes in the body. Now, the FDA defines a peptide versus a protein based on the amino acid chains. If they have less than 40 amino acids, they're called, or they're referred to as a peptide. And if they're more than 40 amino acids, they're referred to as a protein. So collectively, we can refer hormones as peptides, proteins, steroids, and they have a very important messenger opportunity in the body to regulate various important functions.
Amazing. So if someone has an underlying hormonal imbalance, what does those symptoms typically show up as?
Yeah, a broad range of symptoms with some commonalities. And it really depends on the hormone that is causing this change. So I'll give you a few examples. Let's first dissect the hormone system. The hormone system is a very intricate hormone system. Think about it as the conductor of the body's orchestra. And every instrument in the orchestra represents an organ, with the master conductor being the pituitary gland. The pituitary gland is the master of the ceremony, and it's located right behind our eyes in our brain. The pituitary gland is responsible for sending various hormones and signals to regulate different instruments or endocrine organs in the body, namely thyroid, pancreas, adrenal glands, testes or gonads, including ovaries, and so on. So this intricate coordination of signals between the pituitary gland being the master of the orchestra and the various instruments is a very robust system that's very regulated. The regulation comes from thousands of years of evolution, and they talk to one another. Some of them talk to one another early in the morning. Others talk to one another throughout the day. And so the way these organs respond to hormones in a regulated fashion comes from these signals called hormones. And some of these hormones are secreted in what we call diurnal fashion, where they are high in the morning, low in the afternoon, and probably lowest in the evening. And a few hormones go through this dance of different regulatory concentrations and pathways throughout the day to ensure that our body is at a state of what we call homeostasis, which is a state of physiologic balance. Once this state of physiological balance becomes unbalanced because of a dysregulation in a group or a single hormone, then we start to develop signs and symptoms of hormonal diseases. And a perfect example of that includes thyroid disease. An underactive thyroid disease impacts 4 to 5% of the population. It's a condition known as hypothyroidism, with the most common cause being an autoimmune thyroid disease or Hashimoto's. An underperforming thyroid can cause several metabolism-related signs and symptoms, including dry skin, constipation, decreased energy, sluggishness, hair loss, weight gain, excessive sleeping. So,
And infertility in women as well.
absolutely. And so when you look at all these signs and symptoms of a single dysregulated hormone, being the thyroid hormone, you get a sense that hormones play a crucial role in almost every cell of the body, and any dysregulation of these hormones away from a physiology state or a homeostasis state can give you a multitude of signs and symptoms that impact so many different systems in the body. And so symptoms and signs related to hormone changes can impact almost every cell in the body. We as endocrinologists always ask about different signs and symptoms because we want to tease out this sort of multimodal and multi-system phenomena of endocrine disease. And then we work with our team members, including nutrition, mental health coach, and other subspecialty related doctors to try to tease out what other manifestations are there that may pinpoint towards an endocrine problem. We then use biochemistry, so biochemical analysis, biomarkers such as the TSH and free T4 and T3 in the context of hypothyroidism, to then define the condition. So a lot of endocrine-related conditions and diagnoses rely on this sort of sequence of events from symptom to a multidisciplinary team approach to understanding what's going on in the body to biochemical diagnosis and then imaging to ascertain the condition. And collectively, we then give a diagnosis and treat accordingly, whether it's an overactive state that requires suppression or an underactive state, in the case of hypothyroidism, that would require replacement of hormones. And sort of this sequence from symptom to diagnosis is shared amongst most endocrine conditions. And we as endocrinologists play this important role of putting these pieces of the puzzle together to bring back the individual from a disease state to a physiologic state.
Amazing. So when we specifically talk about the dominant sex hormones in men, testosterone comes to mind. And for women, estrogen comes to mind. But do we also find estrogen and testosterone in both males and females? And how would those symptoms look like if there were deficiencies?
Absolutely. So these sex hormones are steroids, and steroids are hormones. Steroids are produced by the adrenal glands and the gonads. In men, they're predominantly produced by the testes and in smaller amounts by the adrenal glands. In females, by the ovaries, and in smaller quantities by the adrenal glands. They play an important role in the fetal development when the fetus is developing, and then a much more important role when the fetus will choose their sex, so male, female, based on the concentration of these hormones, which is also dictated by the influence of genetics. Then, during puberty, these hormones play an important role in secondary sexual characteristics. For example, males will develop male hair pattern because of the excess of androgens and testosterone being an important androgen that will determine these characteristics. In females, driven by the estrogens and the progestins, they go into a phase of menarche, which is the menstrual cycle that lasts up until about 51 years of age. And estrogen plays an important role in regulating the menstrual cycle, in addition to other important roles on bone, cardiovascular disease, cardiovascular health, metabolism, and so on. While estrogens are more predominant in females and testosterone and or other androgens are more predominant in males, they are present in males and females respectively, and they play an important role in ensuring an overall physiology, yet at smaller levels. For example, Testosterone is very important in the female's body. It helps regulate metabolism, contributes towards the wellness of different organs, including pelvic organs, helps with concentration, memory, and it probably has so many other important characteristics that we're yet to find out through appropriate research.
Libido is a big one.
Libido is a huge one. Estradiol, conversely, or estrogens, are equally important in male. Skin health, cardiovascular health, metabolism, and so on. Now, I think it's important to not separate these hormones as male and female hormones, but to collectively call them as important hormones in any individual, independent of the phase of life they're going through. But certainly for individuals that are approaching, menopause and or andropause, it's important to consider repleting both hormones and ensuring that they are in the desired optimal ranges, independent of someone's sex. So, for example, testosterone replacement therapy in females is a very important consideration for libido, quality of life, improving various organs, including pelvic organs, from age-related changes, including prolapse, cardiovascular health, metabolic health, and so on. So in my practice, I provide testosterone replacement therapy to females to ensure that it has this important additive effect to the overall hormone replacement therapy strategy with estrogen if I'm targeting the perimenopause, postmenopause, sort of menopausal related treatments. Conversely, in men on testosterone replacement therapy, they do get elevated estrogen levels from conversion of testosterone in peripheral tissue to estrogens. And in my practice, I do not suppress these estrogen levels with medications that will lower the conversion from testosterone to estrogens, including aromatase inhibitors, because a little bit of estrogen in a male can be equally healthy for various metabolic pathways. And so I don't differentiate between these hormones based on someone's sex. In fact, I try to optimize levels to ensure that we approach these different hormone replacement therapies to achieve optimal ranges that will improve someone's metabolism and then overall health.
Amazing. So Fady, help our audience understand, if we're talking about a middle-aged man, what symptoms could they potentially be experiencing if there is an underlying testosterone deficiency, and how will we go about in our practice confirm a diagnosis and then initiate treatment?
Absolutely. So after the age of, or in our 30s, testosterone tends to decrease in value by about 1% per year. And males will go through a phase of andropause as well, typically later onset than the age of menopause in females. But what we find in practice and in sort of real world data is that people tend to develop signs and symptoms of poorly optimized testosterone levels, sort of suboptimal testosterone ranges that can be non-specific. So non-specific symptoms include fogginess, decreased energy, putting a little bit of weight, poor sleep, decreased libido, which can be attributed to so many other conditions, including life stressors, right? So depression, stress, marital issues, relationship issues. And so sometimes it's very hard to tease out whether these general symptoms are arising from a hormonal deficiency and or suboptimal hormone levels that we think that it's age-related. The reality is that this decline in testosterone, which happens, from someone's 30s and so continues onto their later on in age, can likely play an important role in a lot of these symptoms. And so replacing or optimizing someone's levels for testosterone and other hormones will likely help improve a lot of these non-specific symptoms that I mentioned. So what I usually do with my clients is I ask them a long list of questions, typically in the context of review of systems, from hair to mental health, all the way down to tingling in the hands and feet, and hair loss, different parts of the body, and then more specific symptoms pertaining to testosterone deficiency, including decreased libido, hair pattern loss, and so on, and then look at their biochemical levels. A common mistake that we do in practice is to test testosterone levels in the afternoon. They should be tested in the morning on a fasting sample to sort of get that optimal range that we're looking for in the morning as a product of this diurnal rhythm phenomena that I mentioned earlier. So testosterone is highest in the morning. It's influenced by fasting state, obviously by sleep, and by different medications, including exogenous steroids and testosterone. So when measuring testosterone levels in the morning, make sure you do it after a healthy sleep, fasting sample, and weeks after exposure to steroids. And if you're doing it as part of your testosterone replacement therapy, and if you're on a weekly injection, then do it midway between both injections, because the levels can be influenced by the relationship between the dose of testosterone and when the measurement is taking place. So having a low testosterone measured in an optimal measurement setting is very crucial in defining testosterone deficiency, otherwise known as hypogonadism. So make sure that the environment for testing is done the right way. Once you've confirmed and ascertained a deficiency, some societies want you to measure it twice on different samples, but we're typically happy with a single optimal measured sample. If it's below a certain threshold, then we immediately start replacement therapy, aiming for a range that is typically at the upper range of the reference range, between the 70th to the 80th percentile, and or a personalized range depending on someone's desires. Do they want a higher optimal range because they're building more muscle? Do they want sort of a lower optimal range because they just want to get rid of some of these non-specific symptoms, and so on? So it's very personalized, but what I'm seeing is a pandemic of low testosterone levels. Oftentimes it's unexplained low testosterone levels. I wonder whether it's related to all the toxins that we're exposed to in our environment, otherwise known as endocrine disrupting chemicals. And I'm also seeing major improvement in a lot of these non-specific symptoms like fogginess and feeling unwell and not being sort of fully optimized with replacement therapy. So I think that individuals should get in the habit of testing their hormones and making sure that they speak to their providers about, at a minimum, getting their levels to the optimal range, because moving that hormone level, independent of which hormone we're talking about, but moving that hormonal level to the optimal desired personalized range can make a huge difference to someone's life.
So once we've built a diagnosis, Fady, for a male patient who may be experiencing symptoms of low testosterone, and we've confirmed the diagnosis with proper blood work and a morning sample, as you've indicated, what are some of the treatment options men have, and what suits what type of candidates?
Absolutely. There are drug and non-drug related options. We'll start with the non-drug related options. We know that exercise, building muscle can significantly help boost testosterone levels. There are also supplements that can impact testosterone levels. They're available over the counter. Well, it depends on the mechanism, but I think that some of them that may provide sort of precursor to testosterone production, and or if they activate certain receptors in the body, then they may have a potential role in increasing testosterone levels, but not to sort of the optimal ranges that we discussed. I think the most effective way to raise testosterone level from the low reference range to the mid-high reference range would be to start someone on testosterone replacement therapy. And these are readily available. They can come in various formulations, with the most common being the injectable forms of testosterone. Testosterone cypionate, taken twice a week or once a week, or testosterone enanthate. These are injected subcutaneously or intramuscularly. The dose is typically 50 twice a week or 100 milligrams once a week. Cypionate has a longer half-life than enanthate. For those that have needle phobia or don't want to be on an intramuscular or subcutaneous injection, they can seek alternative formulations, including transdermal patches, gels, pellets, nasal sprays, which are likely the most physiologic replacement therapy. However, they're taken in both nostrils, given 3 times a day, so they might be a little bit hectic for some users. We see great results with any of those formulations, but those that want sort of a quicker fix, it would certainly be the intramuscular or subcutaneous formulations that will likely get to the optimal levels. It will take a few weeks to reach sort of that steady state, about 5 half-lives or 5 weeks for the intramuscular or subcutaneous formulations. But that's typically our go-to strategy, with the intramuscular or subcutaneous being sort of first line. We would then repeat measurements in a few weeks to ensure that we achieve the desired personalized range. We also look for other biomarkers that may reveal an early adverse effect as a result of testosterone replacement therapy, including increased hemoglobin concentration, a condition known as polycythemia, because testosterone helps increase red blood cells in the bone marrow, and in fact can help in the treatment of anemia, which is low hemoglobin count. So we want to make sure that the hemoglobin count is within the reference range. We ask about sleep apnea or snoring-related symptoms, because excess testosterone can lead to pharyngeal swelling, and that can in turn lead to sleep apnea-related symptoms. We look at prostate-specific antigen in the blood to look for any prostate-related enlargement, and cholesterol and diabetes-related markers, because excess testosterone can lead to dysregulation in our body's metabolism.
Great. So, Fady, we often see when patients are transferring over to our platform from other clinics or providers, we see sometimes protocols that are a very big dose shot once every 2 weeks or 3 weeks. We see anywhere from milligrams to 200 milligrams shot taken, and then the patients take a gap for about a couple of weeks before they do the next shot. Is that something that we suggest as well, or are you more inclined towards the microdosing and mimicking your natural testosterone production? And what are some of the pros and cons of these kind of protocols?
Absolutely. There are so many different types of protocols, and I think everything should be personalized according to someone's needs. But for an average testosterone replacement therapy, for the context of replacement for hypogonadism, a safe dose would be 50 milligrams twice a week of cypionate, or 100 milligrams once a week of cypionate as a good starting dose, followed by serial measurement of testosterone levels between both injections midweek, to ensure that levels are optimized. I would only go higher depending on someone's initial response to these initial doses. And I would also be cautious and careful in increasing the dose above the desired optimal range, because it is associated with a lot of these adverse effects we mentioned, including sleep apnea, potentially prostate enlargement, potentially elevated hemoglobin, a condition known as polycythemia, metabolic derangements such as dysglycemia, dyslipidemia, and a lot of other potential consequences on different organs in the body. Now, there are non-testosterone-related formulations that can also help boost testosterone levels, including HCG, which will directly stimulate the testes for producing testosterone. It can be combined with testosterone to help preserve fertility, because HCG can also increase sperm production, or it can be used as monotherapy for those that don't want to be on testosterone replacement therapy or don't tolerate TRT for whichever reasons. Another form that is sort of weaker, but also can be used as a replacement to testosterone and HCG is clomiphene. Clomiphene will also help stimulate the testes in producing sperm and testosterone. So we have various compounds today that can be deployed in isolation or together in the treatment of testosterone deficiency or hypogonadism. And it's such an exciting time because we get to provide different personalized therapies to our clients to help them achieve the optimal ranges that they want to achieve. But I would caution against the use of high doses or therapies that are given every 2 weeks or more.
So we also experienced that patients who've previously tried those protocols mentioned that they experience highs, valleys, lows, and then crashes. So a consistent energy level is not maintained often because of these large gaps in their doses and protocols. So are we then aligned that the more closely we mimic our natural testosterone production, does that significantly reduce the risk of side effects, or is there no correlation there?
Yeah, I think that I've also heard of people injecting daily small doses to achieve that cumulative dose of 100 milligrams or whatever it is per week. And yes, testosterone pharmacodynamics and kinetics follow an interesting sort of roller coaster ride, right? So after the injection, you get the peak of these concentrations of testosterone in the body that can lead to personality and or metabolic related changes. And then the concentrations sort of fall down, and some people do feel sort of that withdrawal from not having enough testosterone concentrations in their body. So in order to avoid that sort of roller coaster ride, we typically mitigate it through giving testosterone twice a week injection at 50 milligrams twice a week of cypionate or smaller doses, and avoid sort of longer intervals of therapy because of this withdrawal phenomena. And so I think the safest sort of formulation and administration would be on a weekly therapy, and to create personalized regimens based on someone's response.
Mm-hmm. So how do we feel about the use of growth hormones in men? Is that also conducted after a confirmed diagnosis? And we see a couple of different types of treatment options on the market. There are some peptides like arsamorelin, which is becoming hugely popular.
Yes.
But how does the efficacy of that treatment compare to our standard growth hormone product like the Omnitrope?
Right. So a 2019 study of 10 individuals showed a reduction in biological age and enhanced immunity after administration of growth hormone and metformin and DHEA as a diabetogenic mitigator of growth hormone's potential effect on metabolism. So I do have clients that are on growth hormone replacement therapy because growth hormone is the fountain of youth peptide and drug. It does cause improvement in someone's cognition, memory, immune system, skin health, and can potentially help reverse some of these sort of aging-related biomarkers. Now, it is not indicated as sort of an anti-aging or wellness-related therapy. It's meant to be, it's FDA approved for growth hormone related disorders, including growth hormone deficiency. But again, talking about optimal ranges, creating personalized treatment therapies for individuals that want to be more proactive about their health strategies, I think growth hormone could be used in the right setting and the right dose to achieve optimal levels. And sort of healthier states.
And women can use growth hormone as well?
Absolutely. I think growth hormone can be used by anyone as long as they've reached their adult height, because it could certainly influence someone's height. Also, a caution on growth hormone therapy, particularly higher doses, from the name growth hormone, can lead to growth of various cells. So in theory, it could predispose to growth of cancer cells. Mm-hmm. So don't give it to someone with active cancer. And I would do sort of cancer-related age screening for those that want to be on growth hormone therapy to ensure that we're not stimulating a problem that's already there.
Got it. So Fady, what do we tell people who are using testosterone or growth hormone in higher doses for recreational uses? I think that's definitely coming from an expert's side, some message for them to be cautious, or is that a safe practice? We see a lot of concerns in our practice, especially patients who are trying to join the program, but they're looking for recreational using doses, and that's definitely not something we support. But they have symptoms of severe gynecomastia, erectile dysfunction, they have abnormal lipid panel, higher risk for, of course, blood clots. So what's the message for them?
Here in our practice, we're here to help and serve our community, our clients, help guide them with evidence-based medicine and protocols. And we're here to help them to ensure that they're not getting the adverse effects that may ruin their lives. So we provide dedicated science-backed care. We follow protocols that are evidence-based on our research. And we want to invite them to utilize our protocols to ensure that they're safe and that they will get the results they want in a more supervised environment, right? And same thing in our traditional endocrine practice. We want the best for our clients. We want them to seek expertise care. Today, there are so many different platforms that are available direct to consumer that can offer guidance for individuals so they could be on the right therapy and the right dose under expertise care. And I'm all for that. I don't think we need to scare our clients, but be invitational and understanding and offer them different products and services so that we can meet their goals and expectations. At the end of the day, we don't want to be the police. We want to be a care provider that can actually help guide and meet someone's expectations.
So Fady, how does hormones relate to the topic of longevity, especially enhancing quality of life and health span?
Yeah, so let's define a few key terms in the field of longevity. So lifespan is the amount of time we live on Earth, the amount of time we breathe oxygen from the moment we're born to the moment we die. Life expectancy is a statistical number that defines how long we're going to live. Health span is the amount of time lived in good health without disability and chronic disease. And longevity is the pursuit to live longer, happier. And so an optimized hormone system in our body will lead to a healthier health span, lifespan, and longevity. And so optimizing hormone levels in our body, whether it's in the context of wellness or a disease state, such as the hypothyroidism example that I gave earlier, can certainly impact someone's overall well-being and longevity. So hormones do play such an important role in this field. I'm excited because today there are so many different tools we can introduce to someone's therapeutic plan to ensure that they have sort of a healthy, longer, happier life.
Including peptides and hormone replacement therapy. But how do we feel about the use of supplements in this space?
There's a lot of interesting supplements that can lead to a healthier self. Some of these supplements are known as senolytic therapies, targeting senescence or sort of zombie older cells that sort of escape the immune system and then can go on to develop various chronic diseases like diabetes and or cancers. Some supplements can target these different aging pathways that lead to the production of these senescent cells, including supplements that impact mitochondrial function, such as coenzyme Q10, vitamin E, forskolin, creatine monohydrate, which is an important supplement for brain health and muscle health, and an array of other supplements that could help target different pathways of aging. So I think that the field is still young. It's confounded by a lot of noise and poorly made clinical trials and studies. But I think to achieve a healthier, longer life, we need to look at a healthy nutrition in the context of whole foods, and then to replace and replenish with some ingredients that are not available in, this whole food approach. And then to look at hormones more closely, including peptides and proteins and steroids such as testosterone and estrogens. And together, when combined, can likely lead to a healthier self, which will translate to a healthier longevity. And the field of healthy longevity is an exciting field that looks closely at these aging biomarkers and hemoglobin A1C and lipid profile and Lp(a) and testosterone and FSH, estradiol, progesterone are all part of these healthy aging-related biomarkers that need optimal that need to achieve optimal ranges through replacement therapies and the other interventions that we discussed earlier, such as exercise.
Amazing. So I know there's a role to play for peptides as well, and some of the more popular peptides on the market, like our semaglutide or the liraglutide, the GLP-1s. They're popular for the management of type 2 diabetic symptoms. They're also now being used for weight loss, but do they also have a role to play in longevity?
Yeah, it's an interesting question, and I think we need sort of longer clinical trials to show their impact on longevity. But what we're seeing is an inflection point in humanity today. With the introduction of these drugs that are Health Canada and FDA approved for the treatment of obesity and diabetes, but we're seeing sort of a pleiotropic effect on various systems in the body. They're helping lower Parkinson-related symptoms. They protect the heart, kidneys, mental health. There are trials looking at their impact on dementia. A recent study showed reduction in cancer risk when you're on these drugs, lowering of all-cause mortality, lowering of cardiovascular disease. So it's giving us an important signal that may suggest that individuals that respond well to these drugs through weight loss and sort of these other pleiotropic protective mechanisms will likely live a longer, healthier life. So it will have an impact on their health span. And that in turn will likely translate into living sort of longer, healthier life, longevity. But in order to devise a longevity-related clinical protocols, you would need many years of clinical trials, which is not sort of available today. It's costly, and it will take probably many decades of research and data to reach to such conclusions. But I'm optimistic that on a population level, if these drugs are going to be readily available to a larger population, we're going to see an inflection point in a lot of these chronic diseases. And I hope that this will translate to healthier populations.
But are there any risks or side effects that we should also be aware of?
Yeah, there are always risks and side effects. We're seeing intestinal-related side effects in about 50% of people, which tends to be a transient adverse effect of the drug, namely nausea, vomiting, abdominal pain, loose stools, constipation. Very rarely people may get gallbladder or pancreas-related inflammation. Been reassured by some meta-analyses conducted that the rates of pancreas and gallbladder-related problems are not heightened in individuals on these therapies. Seen in the emergency room, individuals come with severe dehydration and acute kidney injury from recurrent vomiting and loose stools, more common in individuals during the early course of treatment. There is a black box warning on the increased risk of a form of thyroid cancer called medullary thyroid cancer that is a genetic inherited form of thyroid cancer, only shown in mice. But we tend to avoid it in individuals that have a family history of this rare form of thyroid cancer. We give it in individuals with thyroid nodules that and or other thyroid conditions, which is a common question that we get. But speaking, these are safe medications being used by millions of people. And then the sort of pros outweigh the risks. My priority is to mitigate cardiovascular risk in my clients with hormone changes, with the highest risk being fat excess and or obesity. And if I can choose one drug to mitigate this important risk, which is excess fat, that can lead to excess cancer, all-cause mortality, cardiovascular risk, dementia, lower immunity, with one drug that's taken once a week, I would certainly favor it over the risk profile.
So is it fair to say that we can expect a significant decrease in the risk of developing chronic conditions with these novel therapies?
Significant risk, and it's been shown over and over again in randomized controlled trials and observational studies we have today. I think we're at an inflection point today, and we're going to see a major reduction in chronic diseases and their implications on the individual, the community, and the population. It's going to disrupt different sectors, including fast food chains. I think that it's going to help a lot of individuals. Now, we're also seeing lean muscle mass loss with the use of GLP-1 receptor agonists. About 20% of weight loss comes from muscle mass loss, which is a very important risk to consider. So we usually combine GLP receptor 1 agonist with good nutritional plan, including protein intake and creatine monohydrate and resistance training. And I think every individual on a GLP-1 receptor agonist should consider being on a better nutritional plan and to build muscle, to mitigate the risk of muscle loss associated with these substances.
And do you consider these long-term treatments, or could we potentially discontinue once the weight loss goals are achieved?
Well, the organ of longevity is the muscle, and one of the most important longevity approaches would include building muscle. I think everyone should get in the habit of building muscle independent of whether they're on a GLP-1 receptor agonist or not. It's after the age of 50, we tend to lose about 30 to 50% of our power. By the time we're 70, the power loss is more significant in females than males, but a lot of us will become weaker. We'll have frailty, and that will risk of falls, fractures, disease, and that will contribute to our sort of poor health span and shorter lifespan. And so to mitigate, and this could be likely accelerated by the use of the GLP-1 receptor agonist. So I don't use GLP-1 receptor 1 agonist in sort of frail, older individuals to avoid furthering the muscle loss and frailty, and the dehydration that can be associated as well with these drugs in this population. So I would recommend muscle building through resistance and endurance-related exercise in everybody. And that would probably be one of the most important top 3 approaches to longevity.
So Fady, how do we feel about the gut health and its implication on our physical health and mental health? There's definitely a correlation that we're hearing a lot in the media currently. So how does the medicine fraternity feel about that?
Oh, food is medicine. More what you eat. We talked about eating whole foods, but processed foods, forever chemicals, microplastics, anything that can sort of your gut, including the trillions of microbiomes that live in our gut that influence the connection between the gut and the brain and the gut and the hormone system. And if you look at all hormone-related conditions, whether it's the thyroid conditions or cortisol states, they all manifest with gut-related symptoms because there's a very strong link between hormone health and gut health and vice versa. So those that present with gut-related symptoms, do make sure that you check your hormones and that they're in desired range. And if they're not, try to achieve optimal ranges through healthy and or replacement therapies. We have today capabilities of sort of gut health, whether it's through microbiome-related tests that can give us sort of how healthy our flora is. And we can then intervene accordingly to create a more sort of holistic environment. And sort of an indirect way of measuring gut health is to check for hormone changes. And I would, to eat a healthy, balanced, whole food diet, because at the end of the day, we need to feed our gut with the right ingredients. And we need to ensure that our gut is healthy, which will then reflect on other organs in the body.
And is there any correlation between optimal gut health and mental health?
Absolutely. And a perfect condition that sort of reflects this connection is irritable bowel syndrome, which is very prevalent in our population. That with gastrointestinal related symptoms due to mental related symptoms. So if you get angry, you see is not happy, you may get bloating, a change in your stools, abdominal pain, symptoms. And that is because there is a very strong nervous system link between the gut and the brain. And so a healthy gut is a healthy brain, and a healthy brain is a healthy gut.
And we're also hearing a lot in the media about the leaky gut syndrome. Is there a clinical diagnosis for that?
There are different ways of measuring the health of the gut as discussed, and there are different conditions that could lead to sort of a changed gut. Some of these approaches, when tested, can lead to a leaky gut. Whatever it is, it just tells you that your gut is not in harmony, it's not in homeostasis or a good balance. And there are different interventions that can be added, including supplements, brain health-related maneuvers and treatments, food, and hormones that could help sort of important leakages or changes that happens in the gut.
And do we see any correlation between excessive use of alcohol or caffeine that could potentially also impact our gut health?
Yeah, alcohol is a toxin. There's really no safe level of alcohol. Alcohol can help change the microbacteria and the microbiome environment in our gut. A lot of these toxins that alcohol gets metabolized to will then influence our hormone system, our brain health, our sleep pattern, our personalities. And so absolutely, alcohol is a very important toxin to avoid at all costs.
So Fady, is there any key takeaways for our audience to implement a healthy lifestyle from their day-to-day habits?
Yeah, I think independent of whether an individual is trying to seek a healthy life, longevity, optimal hormone ranges, fight chronic diseases, I think it really starts with healthy behaviors. And probably the most underrated healthy behavior is sleep. If you think about it, Hira, we spend a third of our life span sleeping. And so we want that third to be in good quality. So get a minimum of 7-8 hours of good quality sleep. Go to bed at the same time every day. Wake up at the same time if possible, and get good sleep, undisturbed. Make sure that the room temperature is adequate to help you achieve that sleep pattern. And that will help with recovery, day function, helps with the regulation of the hormone system, help with regulating your circadian rhythm, which is that internal clock that helps regulate different processes in the body, including hormone secretion.
We also observe use of our cell phones before going to bed, or watching excessive amount of TV with the blue light hitting our eyes. That definitely has an impact with the quality of sleep.
Yes, it has an impact on different hormones in the brain, including dopamine. It has impact on our sleep-wake cycle, on our circadian rhythm. So as a general rule in our home, no phones 4 hours before bed. Our last meal is at 8 o'clock. We tend to go to bed between 10 and 11. And then wake up around 6 to 7. And that's sort of a constant routine that we have. When we travel, we take melatonin with us, which helps us sort of with that sleep derangement recovery, which typically takes about 2 to 3 days to adjust to. But I think sleep is probably the most important, easy doesn't, of investment to get it right. And nutrition, avoid ultra foods, avoid microplastics and sort of other environmental toxins. So we've let go of all the plastics in our home, including water bottles that have hundreds of thousands of micro and plastics, and they're endocrine disrupting chemicals for a reason, right? Because they disrupt our endocrine system. They work testosterone and estrogen and thyroid hormones by blocking or activating different hormone receptors, and that can lead to cancer of different metabolic and physiologic signals in our body. So healthy toxins. Number 3 would be exercise, get in the habit of building muscles and make sure that you improve your various subjective parameters related to exercise, such as the VO2 max, which is probably the important longevity subjective biomarker done through gas analysis technique on a treadmill, gives you a score, tells you how fit you are, is a body for health span and longevity. Or use, that can do a lot of important measures of recovery and health subjective. And then 4 would be, so then under this category, purpose. Are you happy? Are you depressed? Do you have a good network of people and community around you? How's your spirituality? So I think working on all of these domains, optimizing all of these domains in conjunction with the other 3 points that I mentioned, and following it on a day-to-day routine basis can significantly boost your immune system, fitness, hormone health, recovery, and overall lower your all-cause mortality and development of chronic disease. And you can do that in a very cost-effective way. You don't need to go to these expensive longevity clinics or seek very expensive longevity-related products and services. Start with your home and with your day-to-day activities.
So if we are just getting into the habit of movement and it's for beginners, how much exercise is recommended? Or at a certain point, how much exercise would be too much?
Right. So by the recommendation is about 150 minutes per week of moderate exercise. So go, walk, move, be on a treadmill. And you may want to follow this guidance or something sort of more realistic, which is, a day. And studies have shown that a minimum of 4,000 steps can lower cardiovascular disease. And I think that's easily achievable for anyone today, whether it's movement in home or outside, or through a fitness equipment. Now, too much exercise can certainly lead to injury and disability. So you have to be careful with much exercise in terms of intensity and duration. And a lot of these sort of endurance-related exercises can also help a lot of chronic and cardiovascular diseases, including arrhythmias. So you want to be careful. I think a fair balance is very important to try to avoid the development of these diseases, including cardiovascular disease, through strenuous stick to healthy related exercise, get your steps in, and build muscle if you can.
And any science behind some of the latest trends we're seeing in this space as well with regards to the use of red light therapy or sauna therapy? We're hearing a lot in the media, but I always have not been able to understand if there was any science to support the claims.
Yeah, so the field of regenerative therapy is exciting and undergoing an inflection point as well. So photobiomodulation, which is the science of light therapy, has a lot of evidence behind it, whether it's full body light therapy or intravenous or intra-articular therapy, which helps with rejuvenation. It has regenerative potential. It lowers inflammation, helps with wrinkles, it has an anti-wrinkle effect, helps with skin aging. And according to different hertz and frequencies, it could help with also different systems in the body, including gut health and brain health. So it is a growing science. It's being used as sort of an alternative method to boost someone's overall well-being. And I don't think we need to shy away from it. I think we need to be inclusive of all these other interesting, alternative health and wellness.
So Fady, you've always been a great supporter of Science and Humans, and we're very grateful to you for all of your support. In terms of the platform and how the services, we've really tried to remove as many barriers to accessibility as possible, along with making sure that we provide the best of quality care, the latest research, and constantly investing in training our practitioners. So, how do you see overall? Could you foresee that there could be a potential change in demographics and the quality of health in Canadians after all the hard work's done?
Absolutely. I'm very excited about Science and Humans platform in providing digital health solution directly to consumers to fight accessibility, misinformation, and really provide evidence-based, scientifically proving products and services to provide access to a lot of these important therapies for our clients' wellness and overall health span and longevity. We need more of it. I think Canadian clients and patients need access to state-of-the-art care without delays. And Science and Humans, through their incredible tech-enabled platform, is helping bridge the gap between consumer needs and evidence-based science.
Amazing. Fady, just as a last thought, I wanted to touch base with you on what is the importance of wellness testing for individuals? Do we test once and forget, or is there any incentive retesting to monitor our progress as well? And what markers would you suggest most men and women should test for in a certain age group?
Right. So if you look at how healthcare systems were initially designed to really take care of the reactive care model, right? So you present with a symptom, you go to a healthcare provider to sort of have care of. I think consumers today want something more towards the proactive wellness care model, so they can feel empowered about their bodies and make choices about sort of the model they want to interact with. And Science and Humans provides such an exciting platform for proactive health management in that today consumers can seek the right guidance, not limited to hormones, because Science and Humans offer hair, longevity, sexual health related products and services. But it provides individuals a platform for proactive health management. And that will give and empower the consumer with a platform that could help them test at baseline and then retest in the future to stay proactive within the various sort of subspecialty domains that Science and Humans offer. So I am all for proactive healthcare management to help empower our populations with the right and necessary tools for early disease detection and proactive healthcare management so we can all become optimized through various healthcare-related resources.
Amazing. Thank you so much, Fady. This was wonderful. I'm sure our audience got to learn a lot from you today, and we hope to keep the conversation going with you in the future.
Thank you, Hira. It's my pleasure.
Take care.
Thank you.
Thank you so much, everyone, for joining us today. And stay tuned for future episodes of our podcast. If you have any other questions that you'd like to ask our future guests in the hormone optimization space, or what kind of guests would you like to see in the future, please feel free to leave us a comment and we'll sure to consider that. Bye.